Hello, my dear. I'm Dr. Alaa Mosbah, Professor of Obstetrics and Gynecology, Faculty of Medicine, Mansoura University. Okay, let us start with a multiple choice question in gynecology, part 14. Okay, choose the one best response. Okay, let's start with the first one. A 41-year-old woman had pelvic discomfort for 6 months, along with 6 kilogram weight loss, nervousness, and excessive sweating. An ultrasound examination showed 11 centimeter cystic and solid ovarian mass. The mass was removed, and on gross pathologic examination there was hair, sebum, and prominent tooth-like structure. Which microscopic finding is most likely to be seen in this biopsy? Which microscopic finding is most likely to be seen in this biopsy sample? A. Neuroendocrine cells. B. Thyroid follicles. C. Trophoblastic cells. D. Yolk sac remnant. E. Neurological cells. Please choose the one best response. Okay, this lady, 41-year-old, has a complaint of pelvic discomfort, also weight loss, 6 kilogram, and this should be considered. Also nervousness and excessive sweating, together with mixed solid and cystic ovarian mass 11 centimeter. This mass after operation contain hair and prominent tooth-like structure. So this is an ovarian tumor case, mostly teratoma because of the structure found here. And if we look to the symptoms, nervousness, excessive sweating, weight loss, the signs of thyrotoxicosis. And there is a variant of teratoma called stroma ovarian, in which there is thyroid tissue. And some patients complain of thyrotoxicosis. In cases with stroma ovarian, which is a variant of ovarian teratoma, some patients complain of thyrotoxicosis. So the expected microscopic finding in the biopsy sample could be thyroid follicles, because mostly this case is stroma ovarian tumor is a variant, which is a variant of ovarian teratoma. So I expect the best one response to be the thyroid follicle here. I hope it is clear enough for you. Let us go to the next. A 17-year-old girl attends the gynecology clinic with a history of excessive vaginal bleeding associated with clots during menstruation for the past 6 months. There is a history of easy bruising. There is a significant pallor. Examination of the abdomen is unremarkable. What is the most likely diagnosis? A. Adenomyosis. B. Bleeding disorders. C. Endometrial carcinoma. D. Fibroid uterus. E. Endometritis. Please choose the one best response. As we see, this is a girl, adolescent girl, complaining of heavy menstrual bleeding. Also, she has a history of easy bruising, significant pallor, but no gross lesions. no gross pelvic lesion. So this is a general cause of heavy menstrual bleeding, mostly bleeding disorder. So the one best response here is bleeding disorder. B. Okay, let us go to the next. A 29-year-old woman present by bilateral nipple discharge, no breast masses. She has history of schizophrenia and mildly elevated prolactin level. What is the most likely cause of hyperprolactinemia? A. Medication side effect. B. Renal disease. C. Prolactin producing pituitary adenoma. D. Breast tumor. E. Thyroid dysfunction. Choose the one best response. The one best response here, as you see, this woman, 29-year-old, has galactorrhea or bilateral nipple discharge with mildly elevated prolactin, and she has a history of treatment of schizophrenia. And this medication, antipsychotic medications, antidepressant, and others, can cause hyperprolactinemia. So this is mostly a medication side effect. This is the best answer here is A, medication side effect. Yes. Okay, let us go to the next. A 20-year-old woman present with painless vulvar ulcer, with painless swelling of the regional lymph nodes. What is the most likely diagnosis? A. Chlamydia infection. B. Genital herpes. C. Gonorrhea. D. Syphilis. E. Monilial infection. Okay, this 28-year-old woman has painless vulvar ulcer. So the differential diagnosis of painless vulvar ulcer and the painless swelling of regional lymph nodes. So the best one response here would be syphilis. Chancre. Chancre is a painless ulcer at the vulva due to Treponema pallidum bacteria causing syphilis. Okay, so the best one response would be D, syphilis. Okay, let's go to the next. 25-year-old woman gets admitted for hysterectomy for her prolapsed uterus. She has given birth to 5 children within a period of 8 years. Weakness of which muscle lead to her prolapsed uterus? A. Coccygeus. B. Deep transverse perineal. E. Levator ani. D. Superficial transverse perineal. E. Gluteus muscle. Okay, it's an easy question. I can find the answer easily. The best one response here is levator ani, the most important pelvic floor muscle. Okay, so weakness of which muscle leads to her prolapsed uterus? We can say levator ani. The answer is C. Okay, let us go to the next. A 26-year-old woman felt sharp pain at her vaginal region. She also noticed that there was a small ulcer on the external surface of her left lip. This wasn't the first time that she had an ulcer around her vaginal region. This recurrent ulcer took more than a week to heal. What is most likely causative organism for her ulcer? A. Human immune deficiency virus. B. Treponema pallidum. C. Hepatitis B virus. D. Trichomonas vaginalis. E. Herpes simplex virus. Okay, this is painful ulcer and recurrent, and the best one response here would be herpes simplex virus. So the answer is E, herpes simplex virus. Okay, okay. Let's go to the next. The last step in estrogen synthesis requires the following enzyme: A, 5-alpha reductase, B, 21 hydroxylase, C, 17 beta hydroxylase, D, 11 beta hydroxylase, E, aromatase. Please choose the one best response. Okay, it's easy. The answer is E, aromatase. We know that aromatase is the last step in estrogen synthesis. Okay, a 17-year-old girl presented with primary amenorrhea. She had well-developed breast, normal pubic and axillary hair, and blind ending vagina. What is the most likely diagnosis? A, Mullerian agenesis, B, uterine hyperplasia, C, hypothyroidism, D, congenital adrenal hyperplasia, E, androgen insensitivity syndrome. Okay, she has secondary sector character, well-developed breast, also normal pubic and axillary hair, well-developed, but blind ending vagina. So there is problem in the development of the genital system. So Mullerian agenesis or Mayer-Rokitansky-Kuster-Hauser syndrome is the best one response here. Okay, so the answer is A, Mullerian agenesis. Why we didn't choose androgen insensitivity syndrome? Because androgen sensitivity syndrome, pubic and axillary hair would be deficient or sparse. But here there is normal pubic and axillary hair. So the best one response is A, Mullerian agenesis. Let us go to the next. A 24-year-old woman presents with an asymptomatic thin-walled simple ovarian cyst 4 centimeters in diameter, detected accidentally on ultrasound scan. What is the best management for this patient? A, laparotomy and ovarian cystectomy. B, aspiration of the cyst. C, laparoscopic ovarian cystectomy. D, laparotomy and salpingophorectomy. E, follow-up by ultrasound examination. Please choose the one best response. Okay, as we see, this is a simple cyst, 4 centimeters in diameter, asymptomatic. So we can do follow-up by ultrasound examination. So the best one response here is E, follow-up by ultrasound examination, because spontaneous resolution mostly will happen. Okay, let's go to the next. Forced gravida, forced para, 60-year-old woman is complaining of worsening pelvic pain. Pelvic examination revealed uterine presidentia. What is the most appropriate intervention? A, colpocolysis. B, abdominal sacrocolpopexy. C, sacrospinous ligament suspension. D, vaginal hysterectomy and repair of pelvic floor. E, ring pessary. Please choose the one best response. The one best response here is to do vaginal hysterectomy and repair of pelvic floor. So the one best response is D, vaginal hysterectomy and repair of pelvic floor. This is the end of this quiz. I hope it was helpful for you. Thank you, everybody. Please have a look for my books on Amazon. You can find the link here and I'll put it in a comment. I have a textbook of obstetrics, textbook of gynecology, contraception handbook, multiple choice question book, medical disorder in pregnancy, and the gynecologic oncology book. through the link on Amazon. You can find them either Kindle edition or hard copy. You can get what you need. Okay. Also, I write in a comment my site on YouTube channel. I write it in a comment where you can find more quizzes and more lecture on obstetrics and gynecology. Thank you, everybody. Wishing you all the best.